Hey everybody, I just wanted to take this moment to talk about ChatGPT in relation to healthcare and healthcare education. There's a lot to talk about. I'm not going to get into all of it. I'm really just recording this so that if I don't have access to ChatGPT in my lecture series that I do on campus, because sometimes it's locked up with users or it won't work through firewalls or whatever, I can just use this to share the information. So obviously tons of big news about ChatGPT and a lot about how students, academic honesty and all that. I'm not going to get any of that. I just want to talk about how ChatGPT is like an interesting tool in the clinical environment, using kind of a series of questions that a student or a teacher might use to help educate to certain things. So I've already pre-written my conversation with ChatGPT. I'll kind of just be reviewing the questions, the feedback, and kind of the logical process, kind of following like Bloom's taxonomy in understanding yourself and where you go. So the first thing I asked was, can you describe key clinical findings? This is a really good term because it's something that's used in healthcare, and it's probably something that's easily Googleable, right? You could look at it in Wikipedia for stuff like that. You really could search for something like this easily. It would be worse if I had written like, can you describe clinical things with patients? Like that's not as easily transferable. So ChatGPT obviously gives me a really good definition of clinical findings and observations associated with patient physical assessment. You can stop and read it. I'm not going to take too much time to go over all of these. What's interesting about this is that this is something you could Google. Like for instance, you could take that exact question, Google it, and you'd probably get top 4 or 5 results that are Google Scholar, Wikipedia, because it's going to look for key clinical findings and it's going to pull something up. You have to look through like 15 pages to find a succinct definition, but here it is for you, ChatGPT. That's really nice. And if you're looking for general understanding, that is potentially a good way to go about it. You can ask a bunch of different questions and kind of figure out where to go. But you have to be able to like not only write a really good query or question for ChatGPT, you need to be able to link things or string logical statements together. So let's take a look at the next one, right? Can you relate key clinical findings to clinical decision making? This is a subject matter that we teach in our pathophysiology class, where we talk about taking the clinical findings and getting it all the way into clinical decision making. It's not just about what you see in the physical assessment, it's how that physical assessment information is going to direct the decision making process on the clinical end. Again, we see a really good definition of clinical findings and how their role in clinical decision making is used to guide treatment. There's a good statement here, right? Key clinical findings also play a role in monitoring the patient's progress and determining whether or not treatment plan is effective. So, we have the decision making, we have linked it back to the clinical findings, and we see that circle. Something's wrong, we treat it. Something's still wrong, or it's getting better, and we adjust treatments as needed. There's a good summary statement here at the end. This is something that you could use on a PowerPoint or, a nice, easy, well-written explanation of what a clinical findings are what the relationship is from clinical findings to decision making. Again, this is all broad. If you were asking for specific clinical findings and specific clinical decision making, you wouldn't get exactly what you need here. This is Googleable. This is Wikipediaable. This is not something where someone is going to be using specific diseases to talk about clinical findings. So let's take the next logical step. Can you provide the key clinical findings and decision-making process for an asthma patient? Now, as a respiratory therapist, this is a great, question to ask ChatGPT because it's something we can gut check. It's something that I don't necessarily need to go and confirm every little detail. I wouldn't do this with like ethics and law. That's not my field. I'm not going to ask questions that I can't really confirm the answer on. But here's what's interesting. So we ask the same question as before, but we apply it to a specific disease. That's a pretty easy one. Asthma is, pretty simple. So we see a summary, we see good bullet points. I do like this a lot, obtaining initial history, physical examination, diagnostic and testings. By the way, if you ask ChatGPT to write out like an assessment plan and treatment plan ideology, I played with ChatGPT a bunch of different times. It is very good at pulling the kind of strategies or information that would come from medical textbooks and other respiratory and nursing texts as well. So it follows that logical strand, even though it wasn't asked specifically for that. Kind of expounds pretty well. Diagnostic testing, and again, it says that this stuff exists, but it doesn't necessarily get into details. Like I'm not seeing specifically PFTs. I'm not seeing specifically information that would be tested on. Like for instance, we're not seeing peak flows. We're not seeing things that we would see on a respiratory care exam, or things that I would expect a respiratory therapist to write about on specific papers that I would ask them to do. So it's good general overview. It's good logical flow. In fact, this might be a good synopsis to then write a paper off of as a good idea flow, but it isn't necessarily going to write that paper for you unless you want to give it way more information. We can see interpretation key clinical findings, including their symptoms, physicals, and of course they're talking a little bit about how asthma overlinks with like chronic obstructive pulmonary disease, COPD, bronchitis, and of course other things. It doesn't go into pediatrics or any other types. We didn't ask it that question, so obviously it wouldn't go to different demographics, which is pretty interesting. It talks about formulation of treatment plan, monitoring patient's progress, education, which is always good. Like this is honestly a really good 7-point summary of what I asked for. It's not in detail. Wait a minute. Like I need to know specifically let's say I read this and I want to know the definition of COPD. What is the standard? Now I know to look up the gold standard of COPD. That's something that's a specific, I think it's an ATS standard for the treatment of COPD. So I can ask that and it can provide again a very good summary of the gold standard. This is something that's Googleable, but it's in a good five point bullet point situation. It's not going to make me a master of it, but it's going to give me the information I need to kind of ask more questions, either to ChatGPT or go and research stuff. If you ask the same thing, what does it take to get diagnosed with asthma? Now, this is the last one I'm going to talk about because it took me 5 or 6 times to get a question that would work. The first thing I asked for was, what are the diagnosis requirements for asthma? What are key clinical findings that would lead to a diagnosis of asthma? There were a bunch of different things I asked that didn't really get the answer I was looking for. What I was looking for was FEV1, PFTs. Like I was looking for stuff that a respiratory therapist should know. And we can see here obtaining patient history, physical examination, similar to what we saw up here. But we didn't, it's almost nearly identical in some ways. It didn't cover what I wanted. So it has spirometry. In fact, I think I just saw it. Spirometry's on here. You can pause and see it. It brings up a little bit, but I'm talking like I want a decreased FEV1 below 80%. I'm talking, I want a reversible or non-reversible asthma or reactive airway. And so I just asked, what is the required FEV1 value for asthma diagnosis? This gave me what I was looking for. So this is an interesting situation because this is a general idea of an asthma diagnosis, but this is really what you're going to want to know as a respiratory therapist. Asking distinct questions requires that you know a distinction beforehand. Like the FEV1 isn't even mentioned in this. So when it comes to the logical growth of knowledge, ChatGPT helps a lot because it creates kind of like a sounding board. It's something like, hey, ask, what did you read on ChatGPT? Or I used to tell the students, like, what did you read in the textbook before you asked me this question? What did you try to or attempt to do before you tried to learn anything? And then you just came to me for an answer on a question you didn't really think about. So a really good thing about ChatGPT, in summary, is that the way you ask the question and having the knowledge to ask the right question should help you get the information you need quickly. But you can't just go in and be like, teach me everything I need to know about COPD. I'm sure if you put something like that, it would generate something, but would probably be pretty generic, like this summary right here. You do physical and history. Wow. Oh, you do diagnostic samples like x-rays, blood tests, anything you need. Oh, wow. There's not going to be a lot of key information that you need. You really have to dig into discrete information associated with each pathophysiology or physiology you might be looking for. That's why understanding key terminology associated with diseases is going to be much more helpful than just understanding the generals. Like if I asked it to distinguish the difference between myasthenia gravis and Guillain-Barré, it might be able to talk about the numbness going in different directions. It might also just say that they're both neuromuscular diseases that, potentially cause respiratory failure, depending on the severity and their treatment regimens. I don't know. I'm not going to take the time to do that in this video. ChatGPT is a very interesting tool. It's something I'll probably be using over the next year and testing different ways to use it in education. It helps if you obviously know what you're looking for and you use ChatGPT to either summarize it or confirm something you already know. There's plenty of reports that ChatGPT gets like things wrong and it's not perfect all the time. It's still obviously budding and growing. But from a clinical education standpoint, specifically in like teaching people different pathophysiologies or different pathologies, or all the different things that you have to know for your exams. It provides an interesting tool or an interesting sounding board. You could potentially have a student ask you a question. You could say, put that into ChatGPT and see what it says. And if the question is broad and really obvious, then they might get a broad and obvious answer. Whereas if you get them to say, well, I want to know specifically the dosing regimens that would change from 3 months, 6 months, 9 months, or what would be the different increases or decreases in medications that I would see to patients who are not responding to a specific treatment regimen, then potentially ChatGPT will either say, oh, well, that's out of my range or abilities, or no, here it is. So that's all I wanted to show. It's an interesting tool. I'm not going to get into all those major details, but this is just a very simple kind of example of that logical flow of going from I'm asking something simple, I'm asking something a little bit more complex, I'm still not getting exactly what I want. I need to ask a very direct question to get what I want. And then finding a way to get that all in one query is obviously the challenge or the skill of a student or a teacher who wants to see ChatGPT used as a learning tool or device. So hope you found that informative, and maybe I'll do more of these later. Have a good one.